Good afternoon, and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, and this program also airs on CTV3 in Connorsville. My thanks to John and his staff down there for being willing to air this program. Our doctors, they haven't changed, and one day we should at least change you all in the seats. Dr. Thomas Huth, Vice President of Medical Affairs for Reed Health, and Dr. David Jetmore, Wayne County Health Officer, will be joined on the phone, hopefully in a little while, by Christine Stinson, Executive Director of the Wayne County Health Department, talk about a drive-through mask giveaway that's happening tomorrow. You mentioned, Doctor, that there are 2,000 masks.
2,000 masks, all made by people in the community and donated to the Wayne County Public Health Clinic, and that gives you a good feeling, you know, that the community's behind you and willing to help. So,
great. Dr. Huth, I ask it every week, and I'm not really asking it lightly. How is the staff at Reed? How is everybody there?
I appreciate you asking after them. You know, everybody's doing great. Kind of have gotten into a rhythm. Everybody feels like they know what we're doing. We know what we're doing with the patients, and we know how to navigate all patients through the system safely, including those who are not COVID patients. And, you know, I think everybody's doing great. And what really has helped is just a tremendous outpouring of support from the community in a large variety of ways, from the first responders showing active, demonstration of their care and concern for the Reed staff, to various churches praying for the Reed staff, and members of community sewing masks that we use, not for direct patient care, but we find other uses for it. And, everybody has a really good feeling about how we're doing. However, we do still have COVID, but we have managed to set up almost two systems. One system for the patients who do or are likely to have COVID, and separate that from everybody else. And we don't mix those two, and by that means, we're able to basically construct a almost surgically clean environment for all other health services, so that when you come to Reed for services, we screen everybody at the door to make sure that those who are high risk for actually being sick don't come in and contaminate the environment. That keeps the environment clean and safe for people who need to have other services, have their heart checks with the heart doctors, have x-rays for other purposes, have testing, treatments, surgeries. And I'm really proud of the system that we've set up. It's very, very safe for people to come in and get the services that they need. We've been asking people for a long time to hold off on those, to delay them, but we're getting to the point where we're able to do more and more, and we've got a really good process in place to keep everybody safe.
Nice. Joining us on the phone right now is Christine Stinson, who is Executive Director of the Wayne County Health Department. Christine, are you there?
Thank you for having me.
Thank you for being back with us.
Yes.
Start by telling us how you're doing and how these last couple of weeks have been for you since we've had a chance to talk to you.
Yeah, we've been very, very busy with the COVID-19 response, working with industry, working with our EFS8 partners and the State Department of Health, doing our contact tracing and case investigation on everything that's going on. So we've been kept busy over here.
You've got an event as we continue the conversation of quote-unquote reopening the community. You all are going to be doing kind of a drive-through mask giveaway for those people who are finding themselves maybe needing to go back to work and needing some type of protection, or who just weren't able to get one. Tell us a little bit about that.
Right, that came out of kind of a grassroots effort of a few different people reaching out to the health department saying, "How can I help? What can I do to help?" And they were making masks, and they wanted to get these masks out to the community. So they were dropping them off to us, and we thought, why not do a couple of different things with this event and have a mask giveaway. And that will help the health department to do a couple of different things. It helped us to exercise our capability of communication with our other partners. So we've partnered with the EMA, the Richmond Fire, Richmond Police, and the Wayne County Sheriff's Department to all come together to do this drive-through clinic to give away masks. So that was one reason to do that. The other thing was we're in a new building, and the health department's changed locations, so we want the public to get used to knowing where the health department is. So we're at our new location. The drive-through will happen in our parking lot at 100 South 5th Street, right there at the corner of A Street and South 5th. And it will also help us try to figure out if we'll ever be able to do kind of a mass clinic here, thinking forward of when a vaccine does happen for COVID-19, will we be able to have a drive-through clinic here at our site, or should we be looking elsewhere at some of our other partners that would be a better place to have a drive-through clinic?
I assume the direction that people will be going or should be coming in and out, will that be clearly marked for drivers so that we're not running into any issues?
It should be. We'll have a lot of cones and a lot of traffic direction out there. One thing we don't want to do is to create any kind of backlog in front of the fire department. So we want to keep the fire department open and moving there. But they will come in from let me get oriented here to my direction. They'll come in on the east side of the building. So off of 5th Street, they'll come into our parking lot, which is south of the building, drive through the parking lot, and then they'll exit through an alleyway. And they'll either be able to go north and get back out on A Street, or they'll go south toward the old Richmond Inn.
Okay.
What time is this going on?
It will go until the masks are gone, or until we'll start at 10 a.m. and go to 1 p.m.
Okay.
I fully expect we'll run out of masks. We don't have an unlimited supply of masks. We're really happy with the amount of masks that we have, and we're figuring we're going to have close to 2,000 masks to give away.
This is a drive-through facility, and you even mentioned maybe a drive-through if there's a vaccine. I know there have been in the past with the health departments drive-through flu clinics, things of that nature. Mm-hmm. Talk about, and Dr. Jetmore, please jump into this, what the health department is doing, has been doing, to be able to reach out to people in our community that don't have the ability to drive, they don't have a car, they're used to taking public transportation, they're not able to get a car. Talk about how you've been reaching out to people and providing them with information.
With information
with information about how they can get a mask, about information about COVID-19. Not everybody is as socially connected through phones, through cars, through
right.
things of that nature. For those folks that are a bit more vulnerable in our community, how are you reaching out to them, and what is the plan, if there is one, to be able to help people who can't drive through places?
Right, and that's kind of a thing that I've seen evolve over about the past 15 years. Used to be when you got on your local radio station, you got an article in your newspaper, and you hit pretty much 90% of your population if you got those two things done. Mm-hmm. Now, with the advent of satellite radio and all of this other thing, it's much harder to reach a vast majority of your population. We work with all of our partners, hoping that the radio stations are getting the information out, that we work with our newspapers to get the articles out. We release as many press releases as the public wants, trying to get the good information out there, and then relying on our other agencies to also help carry that baton of information out to the public, and relying on them to help facilitate making sure that everyone has masks. And if there's a resource that needs to be filled, reaching out to our other partners to have them help fill those gaps that the health department just can't possibly do.
And lastly, do you want to jump in on that, Dr. Jetmore, at all? Anything?
I don't really have anything to add to that. I think I do want to emphasize that we do everything we can to reach every citizen that we possibly can. We can't reach everyone, so we kind of rely on other people in the community to help us spread the word.
I know a lot of people have been pointing to today because the stay-at-home order scheduled to expire. Some of that probably got tempered with the announcement yesterday that Indianapolis is going to extend, or the Marion County area at least, is going to extend until the 15th of the month. I think it was announced that with some exceptions, Ohio has extended their stay-at-home order until the 29th of the month. What information or what advice can you give people to kind of help them think about what this reopening needs to look like, how we need to be able to take care of each other, how we need to dress? We've talked in the past that this is not a mask-wearing society, but is that going to become something that folks are needing to be more comfortable with?
Absolutely. I think that wearing masks and good hand hygiene, and again, if you're experiencing symptoms, to stay home. Those are the important things that we still, as we open Indiana back up, whether it's lifting the order today or if it's still going to be a couple weeks away, we need to think about what is it going to look like when we go out there. And I think wearing masks is going to be something that will be the norm. And I think Wayne County is doing a little bit better job than some of the surrounding areas, and that's just anecdotal by me going out. And when I go to a grocery store here in Wayne County versus going to a grocery store in another county, I see about 25% of people wearing masks here in Wayne County, and far less than that in another county. So I think that we're starting to get that message out to the community. And our mask giveaway, we realize with 2,000 masks, we're not even trying to get every citizen of Wayne County a mask at this giveaway. What we want to do is get the conversations happening. Get the conversations happening about masks. I want everyone talking about masks this weekend. Do we wear them? When do we wear them? How do we wear them? Which one looks best with what shirt that I'm wearing? So those are the conversations we want the citizens of Wayne County to be having this weekend.
What mask will go with my shirt? Okay.
Yeah.
I'll think about that one.
Yeah, which mask should I wear? Not should I wear a mask, it's which one should I wear today?
Okay. Before I let you go, is there anything, since we've got you on the phone, is there anything that I haven't asked, haven't talked about that you want to make sure gets passed on to the community?
I think Dr. Huth and Dr. Jetmore do a great job having these conversations every Friday. I think the community appreciates all the knowledge that they put out there. And other than showing up to our mask giveaway on Saturday from 10 to 1 o'clock here at 100 South 5th Street.
All right. Christine
All right,
Stinson.
thank you.
Thank you, Executive Director of the Wayne County Health Department. Appreciate the time. This is Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We should probably get to some of your questions for the doctors before we get into some of the trends and things that Dr. Huth is willing to share with us. So you couldn't have started with a short one, Ryan. Those who go through respiratory care and are told that they likely have COVID are those living in their homes, then carriers. If one person is home, another person goes out, are they spreading, or is that only if they're sick? They don't really know, I don't think, if they're sick when they go out, but we've talked a little bit about how people can separate themselves in the home, how they can disinfect. But if one person likely has it, can you assume, if it's a relatively small household, that most people in the house somehow have picked it up? And what should they be doing?
Well, This is a dilemma because other countries, and China comes to mind, when people became sick with COVID, they were isolated away from their homes with other COVID patients. We haven't done that, and I'm not advocating that we should, but when you isolate somebody in their home, there's a very high likelihood that they could spread the virus among family members. The person basically has to live in their basement with a separate bathroom and have no contact at all with family members. I think Chris Cuomo, the news reporter, was quarantined in his home, and his wife and children got the COVID virus anyway. But the questioner is wanting to know, are the people who are with the person who's being isolated and going out, could they be carriers of the disease? Mm-hmm. And the answer is yes, they could. One of the things that we have to realize is that 25% of people who have COVID have no symptoms whatsoever. So as we go out in society, we have to operate under the premise that anyone we see, whether or not they're sick, may have COVID, and we need to distance ourselves, practice good hand hygiene, and wear a mask.
Doctor, anything you want to throw in?
Yeah, I totally agree. You know, the incubation period is long, and so somebody could actually be, and we know that there can be some transmission of the virus pre-symptomatically, plus so many people who actually have and carry and transmit the virus don't ever get any symptoms. Not sure exactly what that number is, but I think it could be as high as 50%. I've seen estimates of that nature. So to Dr. Jetmore's point, we need to all operate as though anybody we meet out in the public could be carrying the virus and protect ourselves accordingly. And, the masks continue to be somewhat of a controversial subject, I think unnecessarily so. It's really a pretty simple matter. I'm not sick. I believe that I don't have COVID. When I go out in public, though, I still wear a mask when I'm at the grocery store and such. Why? Because I want the people around me to know that just in case I am carrying it, I'm protecting them, as much as I can do. I'm distancing, I'm hand sanitizing, I'm wearing my mask. That's to protect them. And so I think that if people will look at it right, you can see that's my obligation to other people. And so that when people say, hey, I'm not sick and we don't need to be wearing a mask out in public, I think that's really the reason to do it. That's what people should think about.
Okay. Next question. Does Reed have space to continue this separate and safe environment if all reopens and come fall when influenza returns?
I think the answer to that is yes. We would like not to see a huge influenza season, but they tend to be variable. We can't tell how bad a flu season is going to be prior to getting into it. But if we have a typical flu season and we don't have too much increased COVID, we'll be able to manage it easily. We're well below our capabilities at the moment. We feel that we could handle quite a lot more. And so, but I think all of this is dependent on several things. One is whatever the state of the economy is in terms of reopening, people are still exercising due diligence in distancing, mask wearing, hand sanitization. That's number one. Number two is everybody possible gets the flu shot, which is another challenge in the community. A lot of people won't take the flu shot. Mm-hmm. The flu shot is not a total panacea. It's not an absolute guarantee that you can't get the disease. And it is true that in any given year, the efficacy of a flu shot is variable, and there are a lot of good scientific reasons for that. But what we do know is that even if the flu shot doesn't entirely prevent coming down with the flu, We do know that it lessens the severity of disease, lessens the likelihood of severe complications, and shortens the duration. So all of that added together, having a good experience with the flu shot by people taking responsibility for themselves, getting the flu shot, exercising the precautions that we know are helpful for managing transmission of COVID in the community. I'm totally confident we'll keep the total numbers down well below what Reed can handle.
You know, I'd add to that, I am in total agreement with everything Dr. Huth has said, but many people are predicting that COVID will return in the fall, but we don't know that. I'm struck by the fact of how much we don't know when we look ahead. It may return in the fall, it may return in the winter, it may not return. That's not to say we should not get our flu shot, but when I look at the models that we've seen back in February and March, what was going to happen, all of that's changed, so it still continues to be a fluid situation.
Okay. Let's keep asking the doctors. I know there's more questions out there. My salon is small, 2 people, and no more than 4 or 5 at any one time. Booking clients can be adjusted on time when need be. Stations are 6 feet apart. When are salons allowed to reopen?
Well, I was waiting for Tom to take that. But
No, everybody turned and looked at you.
yeah, I couldn't stand up to the social pressure here in the studio. The short answer is I don't know. I want to see salons get back in business, and I realize the salon workers and all small business people, they're suffering, and they want to work, and I want to see them work. That particular situation, having hair care done, pedicures, manicures, massages, they're a one-on-one situation that make transmission of COVID, the chance of that very high if one of the 2 people has that. So it's very hard to, I'm thinking of the closeness and the time spent between the client and the person performing the service. That said, I think when we get the numbers low enough, we'll see these services return. We've got to get the daily cases down, and at this point, when we look at the numbers for the state and the numbers for Wayne County, which is cases of positive COVID cases on a daily basis at Reed, we see a slight fall, but it's very slight. You almost have to use your imagination. It's more of a plateau. So we're going to have to see these numbers down before we can safely let these activities resume. I know that's an unsatisfying answer. You'd like a date and a time, but I just can't be more specific than that.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. Let's get to one more question, and then maybe we can look at some of the numbers. Dr. Huth has been providing those each week, so we can do that. But let's get to at least one more question before we go there. I hear that testing people who have no symptoms is unnecessary, but then I hear thousands of people are going to be tested. Is this helpful? There's testing going on. There's going to be some testing going on at the National Guard Armory. Can you talk to this a little bit, Dr. Huth?
Right. So I guess that with testing, that continues to be a controversial topic because maybe it depends on what test you're talking about and under what circumstances it's being used. And when it comes to the current so-called Pcr tests that we have now that tests for the presence of actively replicating virus in the nasopharynx, in the nose and throat. We don't know what to say about when that is positive and for how long it stays positive when someone is sick. The only thing we can still say for sure is that if you're actively having symptoms of COVID, you should have a positive test. That's not always true. So the test is not perfect. Consequently, for my purposes, I'm well, I feel well. If I don't really have a great reason to get tested today, I probably shouldn't do that, If I'm not having symptoms, what does it tell me if I have a negative test today? So, it doesn't mean I won't get sick tomorrow or on Monday and then test positive. So it's just very limited data that what a test can tell you on that particular test can tell you on a given day. On the other hand, if you're talking about maybe an antibody-based test, which we don't have commonly available at the moment, then you could maybe say more about has someone been exposed in the past. And Dr. Jetmore and I have talked before about how we think that maybe the future of testing is a combination of the current PCR test plus antibody testing that can tell more of a longer profile of am I now or have I ever been exposed? That might give more information. Now, the testing that's going on at the National Guard Armory, that is, I'm not sure if that's just the PCR test or whether they might also be doing antibody testing.
They'll test each patient for
Right.
not only the antibody, but also the PCR test.
Right. So that is part of an effort to just get more tests done, which we agree with. We think more testing should be done. And they are trying to do those testing with people who are preferentially actively having symptoms in accord with the state guidelines for when testing should be done. Now, there is another effort that's being done through the Fairbanks School of Public Health at IU in collaboration with the State Department of Health and a couple of other state agencies that is doing random testing. And we had their mobile lab or their mobile clinic set up on Reed property on, I think it was Tuesday or Wednesday. They invite people, specific people from the community to come and get tested. And they're looking to test, I think it's about 2,000 people over the course of several months. That is intended to be a true random sample of the population. Or 20,000, sorry. And that is intended to generate a statistically valid population sample that can tell a lot more from an epidemiologic standpoint about how far and wide the disease is currently spread. And they're going to repeat that in the fall to see what changes there are. So that is a specific purpose for scientific reasons to study it from an epidemiologic standpoint. And that's all perfectly valid. So what we have here, we've outlined are basically a couple of different scenarios. We've got people who are sick who need to know to make medical decisions. We've got people who the state just wants to make testing more generally available, period. And then we've got these scientific purposes. So it's not really true to say that testing shouldn't be done. I think the real question is, which test are we talking about? What are the circumstances we're contemplating doing the testing? And is it really value added for that scenario?
I think the more testing you have done, to a certain extent, the more you learn. But we've never had the amount of testing we would like to do. That may change in the future. A lot of the testing supplies and whatever are going to hot spots in the country, and we've managed to keep this from not being a hot spot. So we're not getting a lot of the testing supplies that we'd like to have.
Yeah, because I don't want anybody to ever to think that Dr. Jetmore and I are against testing. That's the exact opposite of the truth. We're for testing. If we could get every citizen of Wayne County tested today, I would do it.
That'd be great.
The trouble is we can't test everybody's, and we still have relatively limited supplies of testing capability, and so we have to be targeted in the tests that are available to us still, unfortunately. That is going to change. We're all the time finding more ways to do testing. We're bringing online at Reed a very short turnaround test that we will run in-house. We've just kind of got the machinery running. We've got a tiny amount of the cartridges for it, and we're having to limit that to testing our patients who may be candidates for one of the two clinical protocols that we're participating in, because those clinical protocols require that the patients going into those as subjects have a positive test. And you can see that when we're trying to make a decision about whether a patient gets a specific protocol treatment today, we can't wait 2 days for that test to come back. I need to use my small supply of the 2-hour turnaround tests for that purpose. So we have to limit that for now, but we expect to get more of those over time. In addition to that, in a few weeks, we'll probably be adding the COVID-19 virus, the SARS-CoV-2 virus, to our we have a whole viral panel of other coronaviruses and more viruses besides, that the maker of the equipment for that is adding the SARS-CoV-2 virus to that panel. So that'll be another option for testing that we'll have available, in addition to the testing that goes to the state, to be run either at the state lab or through Eli Lilly, and also testing that we can send out to, currently we use LabCorp as another testing service. So all of these are kind of increasing the amounts over time, and it's going to add up in the foreseeable future to really having almost unlimited supply between all of the sources. But we're not quite there today.
Through all of this, if we sit by the end of the month, and considering we just started a new one today, so that's plenty of time, do you think you'll be at a point where you can at least test most of the people who appear with symptoms? Because right now, you're not even able to do that, as I understand it.
We have opened up more testing before more situations for our respiratory clinic. So we're doing a lot of testing out of our respiratory clinic currently. But if your question is, do I think by the end of the month, could we be testing everybody who comes through the respiratory clinic? I think it's possible. I'm not going to guarantee that. But I think we could be there within the next 30 days, yes.
Okay. You're watching Ask the Doctors on WGTV Channel 11, WCTV Channel 21. There is another question that the voice in my head keeps telling me we have to get to. I'm not understanding how social distancing is possible at a sit-down fashion. I assume this is a restaurant. Even if you're sitting people 6 feet apart at tables, the cooks can't social distance, the servers can't social distance always, and it would be very hard to speak and get orders 6 feet from someone with a mask on, let alone serve them their drinks, meals, checks, etc. All these things need to be taken into consideration as well before opening up restaurants fully. What are your thoughts? Restaurants, they are open, they are still, people can be in the lobby, but only a certain number of people, I believe, is still the exception, 10, something like that.
I don't know what the exact number is, but I can tell you we're going to have to reinvent the dining experience. I think initially we're going to have to limit the number of people that come, and it's probably going to have to be people who spend time together at home, a family, a man and wife, or a couple with their children. Those people wouldn't necessarily have to social distance. They don't social distance at home, but they need to be kept 6 feet away from other people in the dining area. So it would be a limited number of people. The tables or diners would need to be 6 feet apart. Obviously, the waiter would have to approach the table with food. He would have a mask on. the mechanics of trying to cook in the back room are going to be very difficult, trying to distance people. But these things will have to be worked out before this is a safe experience for the public. And that's why that particular business is not open, other than the carry-out portion, because those problems haven't been solved. The person who posed that question posed a good question. It's right. They haven't been solved, and they'll have to be worked out to make this a safe thing.
You're watching Ask the Doctors, and each week Dr. Huth has been providing some of the inpatient trends at Reed Health, and Dr. Jetmore was talking about that number a little while ago. We got I think it's the blue one this week, right?
Yeah.
Okay. Ryan, if you've got that, if you can bring that up, maybe Dr. Huth and Dr. Jetmore can talk about the trends that they are seeing here in Wayne County. Now, this is a diagram that starts on the 20th of last month and goes through today, so there's a lot of days there. You all are both still looking at, and this is a question, kind of a 10 to 14 day trend. Is that what you're looking for, hoping to get out of this, where you're looking for that downward trend?
Yeah, well, if you look at April the 20th, which was 10 days ago, it looks like, whoa, everything's great. We're down to 46 cases a day, and it looks like we've peaked and we're on the downslide. And then you see it fails to descend anymore. It kind of plateaus, kind of teases upward a little bit. And then there on the 23rd, you think, yay, it's come down again. But then
keep going down toward the end of the month and things.
Well, now watch it climb again. So there's a very slight taper downward, but here we are yesterday, 48 cases. That doesn't suggest that we're over the hump or over the curve, so to speak.
Yeah, I mean, I think when you talk about data visualization, data analysis, and you talk about trend analysis, you always have to specify what time frame are we talking about? Mm-hmm. Because I would consider this chart from, say, the short, the medium, and the very long-term time frame. If you go the longest time frame from the beginning of the chart to the end, you drew a trend line through that in a standard trend line fashion, it would be an upward trend. Mm-hmm. That's not really an appropriate way to look at it, though. If you look at that chart from the middle of the chart to the end, it's a slight downtrend overall. But in the very shortest term, what you have is an uptrend. In the last week or so, it has trended up. Now, what's going to happen from here? We can have 3 different guesses, and we'd all be as likely to be right as the other. Is it going to continue to go up? Maybe. Is it going to do as many trends happen to do? They're not simple straight lines. They go up, they go down in a sawtooth pattern. So you'll have an up and then a down further. I would hope that's what's going to happen. Maybe it's bumped up a little bit. It's going to descend further. I hope, but I don't know. Or is it going to basically stay flat for a while? So those are the 3 basic possibilities. It goes up from here, it stays flat, it goes down from here, and I don't know which one is right. So anybody's guess is as good as anybody else's. But I think you would probably agree, Dr. Jetmore, that if we're looking for evidence that this just goes away in the next week and we're back to pre-coronavirus times, that isn't going to happen. That's probably the one thing that won't and can't happen. At the best, in my mind, what we're going to see is a continued slow downtrend over many, many days, many weeks. And that will be the best case scenario in my mind. But is that what's going to happen? I don't know.
I think, Tom, what's going to muddy the waters here is we had pretty much a static number of tests done. If we perform more tests, we're going to find more cases.
Right.
And that's going to push things up, but it'll be artificial. the amount of coronavirus would have been the same in the community. It's just that we've been able to detect it more, and it would make the chart move upward.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We are taking your questions. If there's another question, let's go ahead and go to that. Okay, everybody rub your crystal ball. When will travel restrictions end?
Let me start out with my usual answer. I don't know, which also I'm sure makes our viewers real happy to hear that. I think we're going to have to, in order for people to travel, obviously you can travel by car. I assume they're talking about plane travel or travel to other countries. I think there's still restrictions abroad on travel between countries. I don't think you can travel between countries in the European Union right now. So I don't know when those travel restrictions will be lifted. All of this is driven by the virus, how much virus is around, how safely it can be done. I think as soon as it can be safe, will that happen this summer? It may, if these numbers fall off. And when you look at graphs of all the major metropolitan areas in the United States and in other countries, they've all peaked and they're starting to drift downward. How long will that drift take? When we start seeing decreased admissions or decreased positive tests over a 14-day period every day, I think we'll start thinking about lifting travel restrictions. What are your thoughts looking ahead, Dr. Huth?
Yeah, I guess I have to have travel restrictions maybe defined for me to answer the question properly, but as far as staying at home, if that's really the question, when can stay at home?
I kind of answered it in a general fashion, but
that's up to that's the governor's call, and more than anything else, and he'll be letting us know. But I don't think it's going to. I think what we probably agree on is that none of this is going to happen just all at once. Just let's flip the switch and everything's off. I don't think it's going to happen that way. There'll be some type of phased approach to all of this. We just haven't really heard that much about what that will be yet. And so, probably if the bigger question is when does all of this end, I think the reality is it doesn't end anytime soon. It maybe decreases or changes toward a goal that we'd like to see, but it doesn't just end one day.
Is it safe to say that some of this depends on us following the rules that are set down? Because people are flying, but you keep hearing the airlines now beginning to require that not only their staffs wear masks, but their passengers wear masks. 2 or 3 of the airlines have now required passengers to wear masks on planes. I think the longer we fight that, is it safe to say the longer this will take to return to something that makes people more comfortable? I think we just have to get used to some of the rules that are in place for this to continue to open up, to continue to evolve.
Yeah, and one of the points you raise, Eric, is the fact that if you did tell people, okay, everybody can fly on a plane now, people have been traumatized by this. If we said, okay, everybody can gather for a rock concert or go to a ball game, I think not many people would. I think that it's that fear of the virus that Tom alluded to when he talked about how people have had some anxiety about going to the hospital, even though the hospital is probably one of the safest places you can go in Wayne County to be safe from the coronavirus. So we're going to have to, when we open things up, people are going to have to overcome, their natural feeling of uncertainty that this whole situation's caused.
Next question for the doctors. If If you have been told that you are suspected positive for COVID-19 but not tested and are still having respiratory issues like wheezing after the 14-day quarantine, how do you handle that with work? When should you return to work, making sure that you're keeping customers and coworkers safe? I think this is a question that will probably get asked more and more as some businesses begin to open up and the conversation around Indiana continues. What happens if your business opens up? You have some of that fear that you don't want to go back, but if you're sick, what do you do after 14 days if you're still wheezing? Your folks have probably been in contact with them in some way, correct? If they have gone through your facility.
And they're going away with instruction about self-care, isolation. We have folks staying in contact with them. Their information is being given to the health department to be tracked and traced and so forth by Dr. Jetmore's folks. But I think, other than healthcare, if I'm in some industry other than healthcare and I've been told that I likely have it or I'm tested and confirmed positive, I think that the current CDC recommendation is to not to return to work before 14 days and several days without fever,
3 days without fever or symptoms.
And symptoms are improving. They don't necessarily have to be gone, but the time frame is probably the most important thing, that 14 days from the onset of symptoms. I believe that's the current CDC guidelines still. You might know differently, David, and you can correct me. But for healthcare, it's a little bit different because the concern is that we don't want to keep healthcare workers out any longer than are necessary, and so the recommendation is to take a testing strategy that they need to be out at least 7 days and test negative twice, at least 24 hours apart before returning to work, in the hopes that some people can get back to work before the 14 days are up.
Next question. Got to rub that crystal ball again. What do schools look like for the fall? And I know this is a conversation as we hit what would have been in some college areas that graduation time. People are already beginning to look ahead at what things might look like. I know colleges are talking about maybe still more online classes. They don't know for sure. Smaller class sizes, desks farther apart.
Yeah, you're right, Eric. No one knows what this will be like, but this may become clearer in the months ahead. It's the beginning of May, so we've got 4 months, and if the social distancing strategies we've used work, then we may see a safer climate then. I doubt that we'll be doing anything without some effort of social distancing and wearing masks. I think we'll see a lot more online learning than we've ever seen in the history of education. But that's what I see when I look into my crystal ball, which I didn't have. I left out in the hallway, Eric, in case you want to consult it later.
I'll talk to it later, okay? Is there another question up? How have the houses of worship been handling the social distancing guidelines in the county? Is the county health department getting any questions from these organizations?
I don't know. We haven't. I wish Christine would hear because she might contradict me, but the churches have not been holding services. They in a group. You're hesitant to tell Americans that they can't gather to worship. I mean, this is a country, this is a Judeo-Christian country, and it doesn't matter the religion, and we value that right to gather and worship. But the virus doesn't know that, so we've had to ban groups of worship, and people have complied with this. I think they've been able to have maybe some online services or Zoom services, and we've been able to get through this. Hopefully in the not super distant future, people will be able to return to their churches and synagogues.
Let's keep going. There is some information that this virus is potentially causing damage or issues with more body systems and organs. Is there any potential long-term effects for the body from those who get sick from this virus? Dr. Hughes?
I think that it is true that there's been more discussion in the scientific circles, the clinical circles over the last 2 or 3 weeks about a propensity of patients with severe coronavirus disease to have other sort of consequences of it, in particular, a tendency to blood clot, a hypercoagulability, we would call it. And so that people are more likely to have strokes or get kidney disease or have heart attacks or have peripheral vascular problems. And this is something that's being noted all over the country. And there's been a lot of discussion about what to do about that. And so that may be what the questioner is asking about, and if so, that's a very smart question because it's a little bit of the minutia thing that doctors get into. We don't know where this is going, but clearly there is something different about the effects of this particular virus compared to other diseases like, say, flu or other viruses on other systems like the coagulation system.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. There was a video that I was able to send both of you a link to. It's been on YouTube. It's been taken down multiple times, I guess, but it's been viewed by a lot of people, and a number of news organizations have pointed to this particular video. There were a couple of doctors out in California. They work for Accelerated Urgent Care. They held a press conference, and they were talking about some different things that, I'm not a doctor, so it sounded okay to me. One of the things that they said was that we've been studying this for a while, and we're down to about 6 minutes left to go, so we're not going to have a lot of time to get into this. But one of the things that they said is that this virus, when looked at in its totality, really has not been any more severe than the flu. And that was a conversation that was held early. It kind of went away. It may be coming back. Is that the case? What are we seeing as far as the amount of sickness and particularly the amount of death caused by this virus?
Well, I have to disagree with those particular doctors, and I don't want to disparage them. They're obviously smart guys and know their business. But I wish we'll focus on one thing: that particular claim that it is proven that this is no more dangerous than influenza is just demonstrably false. And I brought a couple of exhibits for you to kind of show that, Eric, and Brian, if you want to put those up. And the first one, the one that looks like a bunch of little pyramids, this is to establish, first of all, Eric, what is the fatality rate of a typical influenza season. Mm-hmm. Now, not a pandemic season. That's a little bit of a different subject, but the typical influenza season, that's the context these doctors were talking about. This is actually from the CDC's website. The little pyramids are each influenza year, and just to cut to the chase on it, the bottom of the pyramid shows the total estimated cases for each season. At the very top of the pyramid's a little yellowish, brownish, I don't know what color that is, tip up there, which is the fatalities. Mm-hmm. And if you simply go along, as I have done for you here, and added them in, calculate the fatality rate for each flu season, it's between 0.1% and 0.17%. The average comes out to exactly 0.13% or very close to that. So go to the next one, Ryan. Then we compare that to the case fatality rate for, so far, the observed case fatality rate for coronavirus. And this is from the Johns Hopkins coronavirus web map, and the bars extending horizontally. The color is kind of yellowish, brown, orange, whatever. For a number of different countries, the United States is the second one from the bottom. That's 5.9%. That's over 45 times the fatality rate of the typical influenza season. Now, that's not the end of the story. Mm-hmm. We know that we're undercounting the total cases. So if we make the assumption that we're capturing all the deaths, but we're vastly undercounting the total cases because we sit here and readily admit to you that we can't test everybody we would like to. We know there are people that we don't test who we think we have it. But if you go with the assumption, as I've heard the State Health Department folks say, that they think we're actually testing and capturing about 20% of the total, which is 1/5. And if you go back to that diagram, Ryan, and you can see that if we adjust that for 5 times and focus in down towards the bottom on the left, lower left, and if we adjust that for a 5 times underestimation of cases, what I've done is I've added in for you, the dotted line is the 0.13% flu season mortality. The solid line that I added in is the adjusted mortality rate for underestimating by 5 times. That's still 1.2%. And that is 10 times, almost exactly, the flu season mortality rate. I think Dr. Jetmore agrees that 1.1%, 1.3%, somewhere in that range is probably about right based on the data that we've seen out of China, South Korea, Singapore, and some other places where they've done a lot more testing. So probably the reality is that we're going to be around that 1% case fatality rate, and that's going to be 8, 9, 10 times the influenza mortality rate. That's my guess. It's just it's a educated guess based on looking at the actual data, which the doctors on the YouTube video didn't provide any data, they didn't show any data, they just extrapolated from a small subset of patients that they see and overgeneralized to the population at large. And so there are some logical fallacies in how they've approached it, and I think my data is a little bit more illustrative of what the reality is probably likely to be.
Okay. We have gotten through another show. Dr. David Jetmore, Wayne County Health Department, Dr. Thomas Huth, Reed Health. Gentlemen, thank you very much again for being with us on Ask the Doctors. We'll be back again next Friday. It's going to be a warm weekend. Go get your mask at the Health Department tomorrow. Thank you very much for watching. Have a great weekend. I wish you well.